I like also to continue with the next presentations. We have the presentations of the sister projects. The first one, let me see, is the one called HWork, Multilevel Interventions to Promote Mental Health in SMEs and Public Workplaces, with Professor Luca Pietrantoni. He's from the University of Bologna in Italy, and he is the coordinator of the HWork project and the head of the research unit in human factors, risk and safety at the University of Bologna. His area of expertise is related to organizational psychology, human factors in safety and security issues. So, Professor Luca?
Yeah. Good morning. Can you see the presentation? Yep. Okay. Thank you very much for the introductory notes. Good morning to everyone. Thank you for organizing this joint webinar. It's really a pleasure for me to present the overview of our HWork project. As you can see from the title, the HWork project is about designing and implementing multi-level interventions to promote mental health in SMEs and the public sector. The project started a little bit before the pandemic. The duration of the project is 42 months, and 9 European countries are involved. 10 intervention sites have been identified in different countries, and 14 partners are members of the consortium. We have different background. We are a transdisciplinary project with different expertises and different partner types. So 7 universities are involved, 2 SMEs, 2 European associations and networks of mental health professionals and occupational health experts, 1 public health service, 1 private companies, and 1 no-profit organization. The project is based on a specific strategy and approach. I will present briefly the 3 pillars of our strategy. The first is a bottom-up and participatory approach, in which needs analysis is a key element in designing and delivering interventions to promote mental health in the organizations. So in the first phases of our project, we conducted focus groups, interviews. We gathered contextual and objective data in the organizations so that we could have a clear picture of the needs of the employees and the employers at different levels in the organizations. We know that smaller enterprises and the public agencies might have less resources and less knowledge to manage mental health issues, and also might have more barriers in implementing effective interventions. And this needs analysis phase have been very useful in order to design a better intervention. The intervention strategies that we are implementing are based on a positive psychology approach, focusing on the strengths and the resources of individuals, teams, and organizations. As we are living in work environments that are more and more digitalized, we decided to focus on digital and non-digital solutions, trying to analyze advantages and disadvantages of digital-based intervention. And another important elements of our strategy is a IGLO model that has been proposed by experts in the field, in which the antecedents of employees' well-being can be analyzed at different levels, at the individual level, at group level, at leader level, at organizational level. So effective interventions should be delivered at different levels, at multiple levels, in a complementary manner. And that's why the IGLO model is an important element of our strategy. The third pillar is the focus on the evaluation. So we will assess the direct and the indirect effects of our interventions, the outcomes, the behavioral, the organizational, but also the economic evaluation, as it has been mentioned earlier. So the phases of the projects, especially in the first round of the 5 intervention sites, are 3, basically. The needs analysis that we already completed. We collected also some baseline data in 2020. Now we are in the middle of the implementation phase, in which we are delivering in different EU countries multi-level interventions. We are already collecting some process evaluation data, and we will finalize the data collection in 2022 and in 2023. As you can see, the research design is articulated at different times. So at T0, we conducted interviews, focus groups, and we gathered contextual measures. At T1, we collected distal and proximal measures and objective data from the organizations. Now we are in the implementation phase, as I said, so we are collecting process measures. And in the next upcoming month, we will gather follow-up data, objective, distal, and proximal as well. So far, 4 intervention sites have been involved, 3 from the public sector, 1 hospital health service in Italy, 1 Minister of Infrastructure and Water Management in the Netherlands, and the 1 Higher Education Institute in Germany. And 3 SMEs are also being involved in this first phase, 1 from Spain and 2 from Czech Republic. As you can see from this figure, our intervention strategies is based on the IGLO model. So here you can see the interventions that have been implemented and delivered in the different EU countries. So as you can see, in Spain, in 1 intervention site, we delivered the intervention at group level, leader level, organizational level. In another intervention site at an individual level, leader level, and organizational level. So what we would like to understand is how interventions can be effective, focusing on the synergistic effects of the different interventions. In some cases, as you can see, the interventions have been delivered at 2 or 3 levels. In some other intervention sites, we will have the opportunity to analyze the synergistic effects considering the 4 levels of our framework. Here are some examples of innovative interventions that we are delivering. The social mapping is a tool to improve teamwork, analyzing the intra-group dynamics and communication patterns. Hello Better is an online training tool to manage stress or to address other mental health issues. And we also developed innovative intervention tools based on the expertise of one of our partners from Spain, University Jaume, and the work and organizational psychology team in the university that developed micro-coaching, positive stress management intervention toolkit. And these toolkits have been adopted and adjusted to the H project's needs. So far, 42 interventions have been delivered in 6 intervention sites. 4 intervention sites, 4 other intervention sites have been already contacted, and needs analysis has been carried out as well in the other 4 intervention sites. So in total, 10 intervention sites. During the needs analysis, we conducted 46 focus groups, more than 100 face-to-face interviews. We gathered baseline data from more than 2,000 participants, process evaluation records from more than 400 participants, and around 400 have been recipients of our interventions. We are one of our partners in the consortium has the objective to manage the data and to develop a data management plan. So we are collecting data, and we are creating an HWork data bank that will be used in the upcoming steps of the project. Some challenges that we are facing in the project, some of them are more related to the management of the project, some other are more scientific and theoretical. As it has been mentioned, the COVID-19 pandemic has been a disruption in our project. We have been forced to change some of our plans, but we also tried to take the opportunity to address the new needs that were self-evident during the first phases of the pandemic. So we had to change the intervention modality from in-person to online, and that was not an easy task in some cases. We tried to get the proper support from the organizations, but in some cases, especially in public agencies, the organizational complexity was high, so that was also a challenge. And as you can imagine, coordinating in different EU countries and in more than 10 intervention sites, it has been a little bit problematic, but we have been very good in facing all these barriers and problems that occurred along the process. In any case, all the facilitators of the interventions have been properly trained, and we are now harmonizing. We are in a very good way to harmonize all our interventions in the different intervention sites and in the EU countries. So the COVID-19 pandemic has been a major issue in 2020. So it forced us to change some of our plans. During the pandemic, we were supposed to collect data in a hospital and in Italy, and we decided to gather the data and to identify the needs of the healthcare workers, considering the COVID-19 challenges. As you can see, we published recently a paper in which we analyzed the demands and the resources according to the job demands and resources model at different level. And as you can see, COVID-19 is putting a lot of emotional loads on healthcare workers. It hampered communications, the social climates. It was a challenge for work-life balance, especially in healthcare workers. They experienced an increased workload, high time pressure, prolonged working hours, but on the same time, healthcare workers experienced resources during the COVID-19 pandemic, like proactivity, engagement, personal initiative, extra roles behaviors at an individual level, but also teamwork, interprofessional cooperations, and mental health initiatives that have been delivered by the management or new ICT technologies that have been used to address psychosocial and mental health needs of the healthcare workers. A more scientific challenge is related to the direct and the indirect outcomes of our interventions. This is a conceptual model for integrated organizational intervention that has been developed by Sorensen and other experts in the field. And as you can see, when we are analyzing the effects of workplaces, policies, programs, and practices, we can identify different effects. So policies, programs, and practices can change the conditions of work, can change proximal outcomes, and eventually worker outcome and enterprises outcomes. And in our intervention, we had more difficulties in changing work organizations, conditions, and we focused more on psychosocial work environments and job tasks and demands. And we will analyze the proximal outcomes in terms of changing attitudes, changing knowledge, skills, behaviors, and eventually well-being and absenteeism or productivity. Recently, this paper, I think this very insightful paper has been published on how occupational health experts can design, implement, and evaluate organizational interventions in order to have maximum impact. And these 10 Sigtuna principles have been very helpful in giving us some insights about some principles in designing more effective interventions. Here we can see the first principle is about ensuring active engagement and participation among the key stakeholders. And in our needs analysis phase, we dedicated efforts to ensure engagement from stakeholders. In reading other principles, there might be, on our experience, we might have, we need to focus a little bit more on addressing some of these principles because we think they are key in delivering successful organizational interventions. One of our key elements has been, as I said, the evaluation. And we are very much interested in analyzing the effects of our interventions using a CMO configuration. So analyzing the context, the mechanisms, and the outcomes, and then understanding how an intervention works, why it is working or not. So we will use different frameworks so that we can get a clear picture of the changes that have been implemented or not as a consequence of our interventions. So we might have situations in which the changes are not there, or they are not implemented as planned, or situations in which contextual factors hinder the implementation of the activation of the working mechanisms of the interventions, or situations in which the changes are implemented, but we are not sure about which mechanisms have been activated, or situations in which the intended mechanisms are being activated or other unintended mechanisms are being activated, or undesirable situations in which negative mechanisms are being activated, and luckily this will be rare situations. In our consortium, we have also the expertise of experts in economic evaluation of health interventions and mental health interventions. So one important element will be the economic evaluation of our intervention that will be conducted by our Swedish partner. So different economic evaluation methods will be used to evaluate cost benefits and the cost effectiveness of our interventions. And we do believe that it is important to assess interventions on a wide variety of criteria. We published papers on our preliminary, based on our preliminary activities. All these papers are open access. As you can see, these are 3 papers. One is a broad overview of our project and the approaches and strategies of our project. The second is about workplace mental health promotion in a large state organizations in Germany. And the third is based on the needs analysis that has been conducted in the healthcare agency in Italy. Another important success that we achieved is that a spin-off project has been kicked off recently that will be led by NTNU. It is funded by the Research Council Norway as a supplementary funding for H2020 projects. And this will result in e-learning tools for HR personnel, videos about the job demands and resources model, and massive online open courses for researchers and practitioners. We will present the results of our activities in upcoming scientific conferences like the European Association of Work and Organizational Psychology Conference that will take place in Glasgow in 2022, the European Academy of Occupational Health Psychology in Bordeaux, and the European Congress of Psychology in Ljubljana. We have social media, Twitter, LinkedIn that are getting more and more popular, and our dissemination and communication partners are very much active in interviewing experts, and the European Federation of Psychologists Association newsletter is dedicating in every newsletter a section on HWork and HWork related activities. To conclude, we are aware that fostering mental health at work is key, is challenging, but is even more challenging in dynamic and changing work environments. Here you can see some reports from Eurofound in which the focus on mental health has been emphasized in relation to the pandemic, to the current pandemic, but also we are experiencing trends like the increased and permanent remote working. We are experiencing track transformation in our working conditions, in our working tools, and it is very much interesting to notice that in many workforce trends that has been recently published by Deloitte or Morgan Stanley or other international agency, there is very much emphasis on mental health needs and how to design workplace for well-being and how to boost workers' mental and physical wellness. So it's time for me to conclude. I would like to thank all the partners and all the staff that are highly engaged and motivated in this project. And I would like to thank you all for your attention.
Thank you so much, Luca, for this comprehensive and nice presentation. Maybe we can have a couple of minutes to one or two questions. Here we have a question in the chat. Is it already available for others to use these interventions?
Sorry, the question is it already available?
Yeah, somebody wrote, Dicta Vidmar, says, thank you for the information about the needs analysis in HWork. Is it already available for others to use, at least some preliminary results?
Yes, some of our public deliverables are already available in the website, as also the scientific publications and some presentation at conferences in which the needs analysis approach is described. So yeah, some preliminary results are available and these tools can be used. But of course, in the second half of the project, we will have an innovation platform in which all the tools will be openly available.
Okay, thank you. Is there any question for Luca?
I'm going to put the website here in the chat so everybody can have a look at it.
Yeah, thank you, Kerry. I have a question regarding the implementation of these interventions. How is the response rate? Do you have some idea of the response rate of employees?
The interventions are based on are voluntary based. We are experiencing that many workers are really participating actively. We are gathering more detailed information about the rates, especially in these months, because we are collecting process measures. But what we can experience is that there is a needs that needs to be addressed, and many workers are really highly motivated in participating. So we had like more demands than resources in terms of offering interventions. So we had, for example, to train more facilitators to deliver interventions.
Okay. And have you found also the differences between white collar and blue collar employees, or
We found different rates depending on the sector. So in the public sector and in the SMEs, yeah, there was some differences.
Mm-hmm.
Especially because small and medium enterprises have been severely disrupted by the pandemic.
Yeah.
So we had also to change some of our intervention sites along the process. On the other side, in the public sector, the hierarchical structure is in some cases more complex. So to get support from the organizations, it is more consuming and more complicated. But we have been very effective also in this, also because we had the time to dedicate all these efforts in our first phase.
Yeah, so congratulations.